Here we go now. Get set. Afternoons with Annie.
94.3 Radio 1. This hour is dedicated to Cancer Awareness Month, a rare type of cancer called retinoblastoma. One of my listeners happened to approach me when he heard me talking about another disease that I was talking about creating awareness on my show, and he shared his story with me about his 2-year-old daughter undergoing a cancer treatment for retinoblastoma, a cancer that affects the eyes. And by the time the diagnosis is done, many children have lost their eyesight. Since he is a learned one, he happens to be a PhD in medical science, a nurse to be precise. It was pretty early in the cancer that was developing in his daughter that he could point out that something was wrong, and the diagnosis was done, and they are going through a successful treatment so far. We're not only going to talk about the progress of the treatment, because we've had one chat before, but he's also going to share about the campaigns that he has started for more and more awareness amongst general public and parents alike about this, having parents of children who've undergone this treatment come together, and also conferences for doctors to talk more about and to learn more about retinoblastoma, a rare type of cancer that affects very young children here in India and in the world. So don't go anywhere. You've got to stay tuned. But first, a request.
Here we go now. Get set. Afternoons with Annie.
94.3 Radio 1. This is 94.3 Radio 1, One World, your station, and my show is called Afternoons with Annie. Like I did talk to you about in the very beginning of my show, that this month is dedicated to Cancer Awareness Month, and Larry Wagh, the father of 2-year-old Abigail, who's undergoing retinoblastoma therapy, treatment rather, with Dr. Sangeeta and Dr. Himika here in the city of Mumbai, raised this with me to my Instagram account and said that there needs to be a lot more awareness about this rare type of cancer, because by the time parents do find out about it and have any inkling of it and the diagnosis is done, there are many children who lose their eyesight. Joining me today are Dr. Sangeeta Mudaliar. She happens to be the Pediatric Oncologist and Head of Department of Pediatric Hematology Oncology in Bhai Vardia Hospital. Dr. Himika Gupta, who is a Pediatric Ophthalmologist, Ocular Oncologist and Ophthalmic Plastic Surgeon, an eye specialist with training in treating eye cancers and plastic surgery related to the eye. Thank you so much, doctors and Larry, for joining me on the show today.
Hi. Thanks. Hi.
So we'll have to revisit retinoblastoma, something we did speak about last time also, but for the sake of my listeners who just tuned in and who've not heard about this, Dr. Sangeeta, can you throw light upon it?
Retinoblastoma is a cancer of retina, so it's a cancer of eye. It's a rare cancer. Pediatric cancers itself are not very common, and retinoblastoma is further less common. But good thing is that pediatric cancers and retinoblastoma, if detected early and in time and started therapy in time, are very treatable.
Dr. Himika, would you also like to throw light upon how, when a child is affected by retinoblastoma, there have been cases, I believe, in the past where they've lost their eyesight?
So when we try to approach this, the setup has to be oriented towards children, towards controlling cancer and taking good care of the eye. Now, often the eye shines, like in photographs, you get the red eye. These kids land up getting the white eye. Often it is missed. Even on their first birthdays, the eye shines like a cat's eye or a dog's eye when you put the headlight of the car. But because of lack of awareness, the disease is not picked up early. And by the time we pick up the disease, actually the stage is a bit advanced in the sense that we are unable to save the eye. So sometimes, more often than not, the vision is lost. And sometimes we also have to land up removing the eye just to save the life of the baby, which is much more precious.
I'm going to slip into a song and come right back on the other side to continue talking about it, to continue talking about Abigail's progress in the chemotherapy and the cancer treatment. So don't go anywhere. This is a Cancer Awareness Month, Pediatric especially Cancer Awareness Month, and we are talking about this rare type of cancer on my show today in an exclusive with Dr. Sangeeta Mudaliar, Pediatric Oncologist, and Dr. Himika Gupta, Pediatric Ophthalmologist, and Larry, the father of Abigail Wagh. Don't go anywhere. Afternoons with Annie.
Here we go now. Get set. Afternoons with Annie.
94.3 Radio 1. On 94.3 Radio 1 World, your station. The show is called Afternoons with Annie. And since it's the Pediatric Cancer Awareness Month, a rare type of cancer that we're talking about, that was brought to my notice by the parent of a 2-year-old girl, Abigail Wagh. Now, Abigail is just 2 years old. Larry, I believe when you first noticed this, it was about, 6 months ago?
Yes, it was after her first birthday that we found this out. That time it was too small. Like there was a shine in her eye, but it was too small. So I could not understand exactly, is it cancer or is it something else that could be associated with her eye. But then as time progressed, the glow started to widen up, and that's how it raised concern to me, and I immediately got it checked.
Now, speaking of the progress, Dr. Himika, tell us the progress of Abigail in the sessions that she's had, the chemotherapy sessions that she's had recently.
So when we treat an eye with cancer in a child, it has to be done slightly differently. We have to watch the eye. We have to see how much is the tumor shrinking. Sometimes we use a combination of laser and freezing therapy to make the tumor go smaller so that overall damage to the eye is very less. We are giving chemotherapy currently to Abigail, and we hope that maximum shrinkage of tumor occurs with that. And when the tumor size reaches a certain stage which can be managed with lasers, we will introduce lasers in her treatment also.
So Larry, according to you, Abigail seems to be doing okay in the post-chemo sessions and the post-chemo recovery?
Yes, Abigail is recovering well, and she has been showing good signs that the tumor, in a recent investigation, it was found that it has shrunk, and also the retinal detachment has formed to reattach on its own. So there is good signs of progress, and Abigail also is showing good signs of recovery. We are just hoping for the best.
Best wishes with you and Abigail and the doctors who are doing such a great job. So Larry, you have also raised this point of extending this pause by putting up a conference where parents of children who have survived retinoblastoma getting together to share their stories. Tell us about that conference.
Yes, this idea was more of Dr. Himika ma'am's idea, and we teamed up together and we formed a support group through which we could find more than 20 families who are retinoblastoma, either survivors or still undergoing treatment. And we will be having a short meet as the retinoblastoma family and survivors meet. The survivors will become our inspiration, and we can understand how they have tackled life and how it can help someone else who is going through retinoblastoma.
So is it open for people who would like to know more about this rare type of cancer, or is it only exclusive to the parents and the children who have survived this or are undergoing the treatment?
For the general public, we do have a webinar which is coming up, and Dr. Sangeeta ma'am would share the details with you.
Right. We're going to slip into a song and come right back. This is the Pediatric Cancer Awareness Month, and we are raising awareness about retinoblastoma, a rare type of cancer of the eye. Don't go anywhere. This is Afternoons with Annie. Stay tuned. Lullaby for no one.
Here we go now. Get set. Afternoons with Annie.
94.3 81 One World, your station. The show is called Afternoons with Annie. Joining me today to talk about retinoblastoma, the rare type of cancer that affects the eye, are Dr. Sangeeta Mudaliar, Pediatric Oncologist, Dr. Himika Gupta, Ocular Ophthalmologist, and Larry Wagh, the father of Abigail Wagh, who's undergoing treatment for retinoblastoma. So Dr. Sangeeta, like Larry says, that you will be the right person to share with us the information about this webinar that everybody can attend. Can you tell us more about it, Dr. Sangeeta?
So this webinar is aimed mainly for doctors and nurses. We are trying to raise awareness. Even though there are doctors and nurses who are not completely aware about the pediatric cancers, as I told you in the beginning, it's rare. So we want them to be aware about the signs and symptoms so that they pick up the disease early. We want to which they can face so that they can do a proper treatment at the beginning so that the mortality rate comes down. In that webinar, we are having Larry also talking about his experience as a parent and a nurse, and we are also talking about retinoblastoma. So that webinar is mainly intended for doctors and nurses to learn more about cancers, pediatric cancers.
So Larry, tell us about the dates. Tell us about when this conference, the Survivor Conference, is happening first, and also the dates for the webinar.
So we we first start with the webinar, which is on 13th of September at 11 a.m. And we have the survivors meet planned for 20th of September at 11 a.m.
All right. And for more details, of course, I think we can visit your Insta handles as well as Facebook handles, which you have started, Larry, by the name of Abigail Wagh, isn't it?
Yes, you can visit our Instagram handle, which is @ABIGAILWAGH. That is Abigail Wagh. And for Facebook, you can visit Prayers for Abigail Wagh.
Before we end, I also want to thank all your listeners. There are many listeners who come out and help treating for the pediatric cancers. They donate very generously. And without their help, it's very difficult. Treatment is expensive, and there are many poor patients who come in and it becomes very difficult for us to manage. But there are many generous donors out there, and please thank on my behalf to all of them.
For sure, absolutely. So like I said, you will find connections or you will find more information if you as a listener want to be part of this cause, which is not only this rare type of cancer, but any other pediatric cancer, and would like to be a part of it and also donate. You can always take the initiative. So thank you very much for helping me raise this on my show, Afternoons with Annie. It's best wishes to Abigail for full recovery. And of course, Dr. Sangeeta and Dr. Himika, thank you so much for the good work that you continue to do tirelessly.
Thanks, Annie and Larry.
Thank you,
bringing this forward.
Thank you, Annie.
Thank
you so much. Thank you so much, Larry, for raising this in the first place. Thank you very much. Bye-bye.
Thank you.
Bye. With that, I've come to the end of my show today, and I'm leaving you with the very last song of my show, Lay Your Head on Me, Major Lazer and Marcus Mumford, and I'll be back tomorrow at 12 noon Afternoons with Annie on 94.3 DD1 One World, your station. Bye-bye.
Check it out. 1212. Hi, I'm Kriti Sanin, and you're listening to 94.3 Radio 1. One World, your station.
94.3 Radio 1. One World, your station. Here we go.